Welcome to the deep dive. Today we're diving into Atlantoaxial Instability, or AAI.
Right, AAI.
It sounds pretty complicated, but basically it's a problem right up in the neck, where the first two bones meet the atlas and axis.
Exactly. And if they're unstable, not fitting right, it can actually compress the spinal cord.
Which is where the serious problems start.
Definitely. So we've gathered information from some detailed medical text for this.
Yeah.
Our mission really is to unpack AI. What is it? Who does it tend to affect? How do vets diagnose it? And importantly, what can actually be done?
And yeah, it's vital to get the seriousness across. This isn't, just a bit of neck ache. It can cause things like a wobbly gait. What's the term?
General proprioceptive ataxia or GP ataxia in the upper motor neuron or UMN, tetraparesis, basically weakness in all four legs.
Right. All the way to being unable to move the legs, maybe even losing feeling. And tragically, it can even cause, respiratory arrest and death in some cases.
It's true. And the causes sort of fall into two main camps. You've got congenital AAI, meaning the animal is born with a predisposition.
Okay.
And then there's acquired AAI, which usually happens because of some kind of injury.
Okay, let's start with who gets this. The info we have really zooms in on the congenital kind. And it's pretty striking. It's overwhelmingly seen in, toy breeds, the really small dogs.
Yeah, exactly. We're talking Yorkshire Terriers, mini or toy poodles, Chihuahuas, Pekingese, Pomeranians, those little guys.
And usually when they're very young, right, like under a year old.
That's the typical picture, usually diagnosed before 12 months. It's actually pretty uncommon in bigger dogs or dogs older than a year, and cats too. And it doesn't seem to affect males or females more often.
Huh. It really makes you wonder why those specific small breeds.
Well, the thinking is it relates to how they've been bred. There seem to be developmental abnormalities, specifically with a part of the second vertebra called the dens and the ligaments holding it together. They might be underdeveloped or malformed in these breeds.
Okay, so if you have one of these little dogs, maybe a puppy, what should you be looking out for? What are the signs?
Well, the most common thing owners notice is that intermittent or progressively worse weakness in all four legs, at tetraparesis we mentioned. And often there's neck pain along with it.
So they might seem reluctant to move their head or cry out.
Exactly. But the neurological signs can really vary. It can be quite mild, just a little bit clumsy, or it can progress to being seriously unable to walk, even paralysis, tetraplegia. It really depends on how much the spinal cord is being squeezed.
And if there's other damage in there, like swelling or...
Right, edema, hemorrhage, or even scarring, which is gliosis, that can all make the signs worse.
And sometimes it might not be the walking initially. The text says some only show neck pain at first.
That's a really important point. Sometimes the only sign is that the animal seems painful around the neck, without obvious neurological deficits right away. Some owners might also see episodes where their dog just sort of collapses from weakness. And when the vet examines them, they might find abnormal postural reactions, how they place their feet and reflexes can be normal or even exaggerated. Muscle tone might be increased too.
And then there's that very serious, rare outcome, acute death, especially after some kind of trauma linked to breathing stopping.
Yes, respiratory arrest. It underscores the potential severity.
So what's actually going wrong in the joint? You mentioned the dens.
Yeah, so in the congenital form, the main issue is usually abnormal development of that dens.
Yeah.
Think of it like a peg on the second vertebra, the axis, that should fit snugly into the first vertebra, the atlas, helping keep things stable.
Okay.
But in these dogs, that peg might be absentaplasia or too small hypoplasia or just shaped wrongly, maybe angled weirdly. Combine that with ligaments that might be too loose.
Yeah, things start to slip.
Exactly. You get that atlantoaxial subluxation, a partial dislocation. The joint isn't stable.
And the acquired kind is usually simpler, like a break.
Generally, yeah.
Yeah.
Usually a fracture of the axis, that second vertebra.
But here's a key thing. For owners of those little breeds, the text says signs can pop up even after really mild trauma, like jumping off the sofa.
Precisely.
Yeah.
Or even just playing rough. Because the underlying instability is already there due to the congenital issue. It doesn't take much to sort of push it over the edge and cause compression.
Right. And bending the neck forward makes it worse.
It can, yes. That flexion movement can increase the pressure on the spinal cord if the joint is already unstable.
Makes sense. It pinches things further.
Which is why that risk is so much higher in those toy breeds with the potential dens problems.
Okay, so diagnosis. If a vet suspects AAI, how do they confirm it? It's not the only thing that causes neck pain or wobbly walking, right?
Absolutely not. That's the first step differential diagnosis. They have to consider other possibilities.
Yeah.
Things like Other congenital issues, trauma obviously, meningitis or other inflammations, maybe a spinal stroke, FCE, fibrocartilaginous embolism, or even slipped discs or, unfortunately, tumors.
So it's a process of elimination to some extent.
It is. And routine blood work, urine tests, they're usually normal in AAI cases, so they don't point directly to it.
So it really comes down to imaging the neck, looking at the bones.
Exactly. Imaging is key. Often they'll start with plain x-rays, radiographs of the neck.
What do they look for in those?
On the side view, the key finding is seeing that second vertebra, the axis, shifted upwards and backwards relative to the first one, the atlas. This makes the gap between them look bigger than normal.
Okay.
And on views from the top or at an angle, they might be able to actually see the dens and tell if it's missing, too small or malformed.
But x-rays mainly show bone, right? What about the spinal cord itself?
Good point. That's where the more advanced imaging comes in. MRI is incredibly useful.
Magnetic resonance imaging.
Yes, because it shows the soft tissues really well. So with MRI, you could directly see if the spinal cord is being compressed.
And see if there's swelling or bleeding.
Exactly. Edema, hemorrhage, scoliosis. You can assess that secondary damage, which helps with prognosis, figuring out the likely outcome.
And what about CT scans? Computed tomography.
CT is fantastic for bone detail. It gives really clear pictures of the vertebrae, and you can create 3D reconstructions. This can be super helpful for planning surgery, if that's the route they decide to take.
Now, the text had a pretty stark warning about doing these scans, needing sedation or anesthesia, but also a real risk involved.
Yes, this is absolutely critical. Because the neck is unstable, just positioning the animal for the x-rays or scans needs extreme care.
You could make it worse just by moving them.
Potentially, yes.
Yeah.
The text specifically warns against bending the neck too much, especially flexing it forward. That could worsen the spinal cord compression, maybe even cause catastrophic damage or death. It's a significant risk.
Wow.
So careful handling is paramount. And also, close monitoring during recovery from anesthesia is vital to make sure they don't suddenly flex their neck while they're still groggy.
Okay, so diagnosis made. What happens next? What are the treatment options?
Well, the first thing the information stresses is consulting a specialist, a board-certified veterinary neurologist or surgeon. This isn't something to manage without expert input, because mistakes can cause irreversible damage.
Makes sense. So what are the main approaches?
Broadly speaking, there's medical management and surgical management.
Okay, let's talk medical first. What does that look like?
Medical management is basically about immobilizing the neck to stop that harmful movement and let things calm down. This usually involves a neck brace or splint.
Like a human neck brace.
Sort of, but often custom-made. It might be a fiberglass cast applied on the underside from the jaw down to the chest, incorporated into a snug bandage to keep the head and neck really still.
And they have to wear that for a while.
Yes, and combined with strict cage rest, very limited activity for at least 8 weeks. And those bandages and splints need changing regularly, maybe weekly, to check the skin and adjust fit.
Are there medications involved too?
Yes, adjunctive medications for pain and inflammation are used, which we can detail in a moment.
Okay. How successful is just the medical approach?
The data mentioned suggests a success rate around 62.5%, which is, decent. And it seems to work better if the signs came on quickly and haven't been going on for too long, less than about a month.
But what if it doesn't work or the dog gets worse again later?
Then surgery is generally the recommendation. Or in many cases, surgery might be considered the best option from the start.
Right. So surgical management, what's involved there?
It's considered the treatment of choice in most cases. The usual approach is from the underside, the ventral side of the neck.
Okay.
There are a few different techniques, but the goal is always stabilization. They might use pins or screws that go across the atlantoaxial joint, often secured with bone cement, polymethyl methacrylate.
Just literally fixing the bones together.
Exactly. Other methods involve putting pins or screws into the bodies of the vertebrae, maybe linking them with small rods or wires. Again, embedding it all in that bone cement for a really solid fix.
Is there any other way to do the surgery? The text mentioned a dorsal approach from the top.
Yes, that's less common. It usually involves using wire or strong suture material to tie a part of the axis spine to the arch of the atlas.
Why is it less common?
The fixation it provides generally isn't considered as rigid or strong as the ventral techniques, so there might be a higher risk of the implants failing down the line.
Got it. And after surgery, what's the recovery like? Still strict rest?
Oh yes. Strict exercise restriction is crucial, typically for the first month. Then a gradual, controlled return to activity over the following month.
And how well does surgery tend to work?
The success rates reported are pretty good, ranging from about 63% up to 91%.
That's a decent range. What makes for a better outcome?
Several factors seem to help. Younger dogs, say under 2 years old, tend to do better. Also, dogs where the signs haven't been present for too long, maybe less than 10 months, and generally those with milder neurological problems before the surgery have a better prognosis.
Okay. Now, are there risks with these treatments?
Complications? Yes, definitely. With both medical and surgical routes, things can unfortunately go wrong. The animal might fail to improve or even get worse neurologically.
Right.
With surgery, there's the risk of infection around the implants, or the implants themselves could break or loosen implant failure.
That sounds serious.
It can be. And with any procedure involving the neck and anesthesia, there are potential respiratory complications. Difficulty breathing, aspiration pneumonia if they inhale something, even respiratory arrest. And sadly, death is a possible, though hopefully rare, complication.
You mentioned medications earlier for support. Can we circle back to those?
Sure, these are mainly for managing inflammation and pain. Anti-inflammatories are key. Corticosteroids, like prednisone, are often used, typically starting at a higher dose and then tapering down gradually.
Okay.
NSAIDs, non-steroidal anti-inflammatory drugs, might be an option too, usually for a shorter course, maybe 1 to 4 links.
And for pain itself?
Analgesics like tramadol are common. Gabapentin is frequently used for nerve-related pain, sometimes pregabalin as well. The text gives typical starting doses for these.
Are there things to watch out for when using these meds together?
Yes, very important interactions. With corticosteroids, you have to be careful, especially with medical management, because reducing pain might make the dog feel better enough to move around too much and cause more damage.
Ah, right. Masking the pain could lead to re-injury.
Exactly, and a huge warning. Never use NSAIDs and corticosteroids together. The risk of serious gastrointestinal bleeding is very high.
Good to know. So after treatment starts, what kind of follow-up is needed?
It's pretty intensive initially, especially for medical cases with the brace. Weekly checks and bandage changes are often needed to monitor the skin and make sure everything is okay.
And then after the brace comes off or after surgery?
Regular rechecks are still crucial. The recommendation is usually around 1 month and 3 months post-treatment. Then maybe monthly checks until the neurological signs are gone or have stabilized for a good couple of months.
And more often if problems pop up.
Absolutely. Any sign of complications or recurrence needs immediate veterinary attention.
It really highlights how complex this condition is and how much monitoring it requires. And that final reminder in the text about what happens if AII isn't treated.
It's sobering. Neurological deterioration, potential for catastrophic spinal cord trauma from even minor incidents, respiratory arrest, and death. It really emphasizes why prompt diagnosis and treatment are so vital.
Definitely. So to wrap up our deep dive here, AAI, Atlantoaxial Instability, is a really serious neck problem, especially common in those small toy broods.
Right. It involves instability between the first 2 neck bones, leading to potential spinal cord compression and a whole range of neurological issues, some very severe.
And getting a diagnosis often needs advanced imaging like MRI or CT. Treatment, whether it's medical with a brace and rest or surgical stabilization, is crucial.
And usually requires specialist veterinary care for the best chance of a good outcome.
Absolutely. You really want experts involved. Consulting a veterinary neurologist or surgeon seems non-negotiable here.
It really does. And, thinking about the strong breed predisposition, especially in toy breeds, it does make you pause and consider the broader picture.
How so?
Well, it brings up questions for you, the listener, to think about perhaps. Given this genetic link in certain breeds, what are the ethical considerations around breeding practices? How do we balance desired traits with potential health issues like AAI? It's something worth reflecting on regarding the health and welfare of these animals.